Palpation means to examine or explore by touching an organ or area of the body, usually as a diagnostic aid. It is an art and a skill which involves number 1, locating a structure, number 2, becoming aware of its characteristics, and number 3, assessing its quality or condition so you can determine how to treat it. The first two aspects of palpation, locating and being attentive to the body's structures, require a thorough knowledge of functional anatomy and experience through mindful hands-on practice. Assessment, the third aspect of palpation, is a vast subject requiring a book of its own. As an experience involving all the senses, palpation requires receptive hands and fingers, open eyes, listening ears, calm breath, and a quiet mind. As you explore the terrain and texture of the body, be sure to bring along all of your sensing tools.